Hello, here is Dr. Pankaj from GGN Clinic. Today I am here to tell you some regarding the treatment of dry skin. Dry skin is a temporary problem, like which is seen in the winter months and in the cold weather or either in a very hot weather. Before I'm going to tell you about the treatment, first of all, I want to tell you about the causes also, like what are exactly the causes of the dry skin. Usually either it is too hot or too cold weather, or if there is low humidity. Low humidity means there is less water in the atmosphere, there is like less humidity. Or when you are taking excessive bathing, when a person takes excessive bath, it creates dry skin. So these are the causes of the dry skin, and there are rare causes also of the dry skin. One of them is psoriasis, the other is thyroid problems, and the third is ichthyosis. Now, going to tell you about all these three problems. Psoriasis is a skin problem for which you need to see a skin specialist or a dermatologist. Regarding thyroid problems, you can either go to your family physician, you're gonna go to a person with a medicine degree, or you can directly go to an endocrinologist for the treatment, because endocrinologists treat the hormone problem and thyroid is a hormone problem. Like hypothyroidism is a cause for the dry skin. But these are very rare causes. Usually the cause for the dry skins are more of environmental. The extremes of temperature, the low humidity levels, and whatever I told you before also, the excessive bathing. Now you must be curious about the fact that what are the symptoms of a dry skin. A lot of people who face this problem, they already know about it, but few who don't know about it and whose relatives suffer from this problem. For them, I just need to tell you about the sign and the symptoms. And sign and symptoms are also very relative, like it depends on the age of the person, the health status, and the area where it is involved. Usually the dry skin is seen in the areas of lower legs, arms, flanks. Flanks means the sides of the abdomen and the thighs. But the sign and symptoms also depend on the area which is involved. Like you feel tightness of the skin after you take a bath, and sometimes the skin appears very shrunken and dehydrated, and it feels rough. Usually the skin, when you touch it, is smooth, but when it is dry it feels rough. And few people have problem of itching, pruritus, and scaling and redness, but usually the redness, scaling, itching, these are not seen until unless it becomes a bit complicated, for which you need to go to a dermatologist or skin specialist. Dermatologist is a person who treats the skin disorders. So now I already told you the causes and the sign and the symptoms, and basically now you must be thinking about the treatment part. So for the rare causes like psoriasis and the other skin disorders and thyroid problems, ichthyosis, you need to go to a skin specialist. But usually for the environmental reason, the dry skin which is caused by the environmental reason, which is more common, you can take a home care. You can take home care remedies, like you can use moisturizers, and moisturizer also, moisturizer after taking a bath. Like you take a bath and you can take moisturizers. And just keep one thing in your mind, that don't use the products which contain alcohol. These are not good for the skin, for especially the dry skin. And take some products which have oil in them. Like when you are taking a bath and taking a bath, you should take those soaps which contain oil. I don't know the soaps which are available here, but I think I know about Dove. Dove is a good soap, which contains oil. It is also very good for the dry skin. But there are other soaps also, like Neutrogen and Bases. I don't know if they are available here, but I know about Dove, so I'm saying it's a good soap for the dry skin. So moisturize your skin as much as possible, and use warm water for the taking bath. Don't use hot water, and limit the bath time, like frequency also, and limit the bath time and frequency. Like if you are taking two times or 3 times per day, you are taking bath, try to take only one time, and Also the bath time. Don't just go to the shower and just stand there for around 20 minutes or 30 minutes or 10 minutes. Just take 5 to 6 minutes or as much less time as possible. It will be good. And avoid those soaps which doesn't contain any oil and which have alcohol in them, you know. And you can also use gentle skin cleansers for the dry skin. And if you're living in an area which is too hot or too cold, you can use humidifier to get like some water in the environment, to water in the atmosphere. So it is better if you can use a humidifier if you live in the place which have extremes of temperature. And regarding the clothes, I suggest you that you go for natural fibers such as cotton and silk. Don't use wool. Wool is not good for the people who have dry skin. You know, it irritates the normal skin. So these are the home remedies. And now you must be thinking then when to go to a doctor, when to go to a skin professional. When all these measures fail, when you tried all these measures and you failed, then I think you can go to a doctor. When your skin feels too itchy, pruritus, when too itchy or pruritus, there is a too itchiness, and then sometimes you feel a lot of cracks wherever the dry skin is there, then also you can go to a doctor so that he or she can give you some lotions which contain corticosteroids. But don't take those lotions which contain corticosteroids by yourself, because you don't know what exactly the problem is. It might be not a dry skin, might be some type of dermatitis or some skin inflammation. So don't diagnose yourself for that, you know. So if you see open cuts, you see sores on your skin, and there is a lot of itching, then I think it's a better time to go to a doctor. Even if there is redness also, a lot of redness, go to a doctor, go to a family physician, go to a dermatologist, any one of them. Everything is fine. Anybody is fine for this, because now you must be thinking that if I don't get the treatment for the dry skin, what will happen? If you don't take the treatment for the dry skin, or the measures at the home care measures, if you don't take, sometimes the dry skin can also lead to dermatitis. Dermatitis is skin inflammation. Now it's an inflammation of the skin, then it has another treatment. Folliculitis is the inflammation of the hair follicles, or sometimes it can also lead to cellulitis. Cellulitis is like when there is an infection in the underlying skin tissues and the lymphatic vessels. So the three complications are there, like dermatitis, folliculitis and cellulitis, if you don't take care of the dry skin. So that's it. And if you have any other concerns, you please write to me at support@ggnclinic.com or support@ggnclinic.org, or you can visit our website also to fill up the online form, and we will definitely send you the advice and whatever is possible, but try to be more clear as possible and use common words whenever you write to me. So my website name is www.ggnclinic.org. So here is Dr. Pankaj, and thank you for listening this small educational lecture from my side. Thank you.